Yes, I think there's no doubt at all that the most important thing is early diagnosis. We've seen that. In my country, in the UK, we had a famous case in a London newspaper of two women. One was from Britain, one from Germany, both with breast cancer, both at the same sort of stage. In Germany, the process was much faster, and the woman was seen, referred, treated, and so is okay. The other case, it was much slower, and so there are a lot more complications. And that's a classic example of where you can show that early diagnosis, getting in early, spotting the signs, having the tests and checks and screenings, that's what makes the difference.
I think that we have had very good experiences in some of the member states on this kind of early screening practices with different kind of cancers. And I duly hope that we could have a European policy that every patient has a right on screening of the cancer risks, be it whatever type of the cancers. There are different kind of methods of doing that. When there's the prevailing risk, be it genetic or age-related. And that could save a lot of money and in Europe, and even more, a lot of human lives and suffering.
I think it's very important that we raise also awareness amongst potential patients. I think it's very important that people do understand what the signs are of certain types of cancer so they can have an early diagnosis. I think it's also important that we train our physicians and our doctors very well in seeing and looking when they meet patients to really have a good diagnosis and a quick diagnosis. And of course also the sharing of expertise is going to be very important. I mean, not every doctor is an expert in everything. So also there it will be very important that clinicians and hospitals work together in making sure that in the end patients get an early diagnosis, but also afterwards the necessary treatment.
There's a lot of talking now about prevention, and rightfully so. It's a fundamental part of not only the EU health policy environment, but also at the national level. However, as ECPC, we believe that not much has been done and told so at the moment about tertiary prevention, so preventing current patients and cancer survivors from getting recurrence after the survivorship, but also from preventing them to develop comorbidities like diabetes, obesity, cardiovascular diseases after they have conquered cancer already.
In Europe, there is a lot of inequalities in access to healthcare, both due to the social conditions, to the availability of resources, to the system organization. And I think this is something that needs to be addressed if we want to improve cancer diagnosis, prevention, and treatment.
The question of early diagnosis has different elements. At first, it has an element of a systematic screening or a systematic approach to looking at diagnosis really across the healthcare system. We have worked at the European Union level on the development of guidelines for the screening of those cancers which are amenable to screening. So essentially in those areas where it makes sense to have broad-based screening programs, where they have developed European guidelines, and this is a first step to have quality in place. The idea of early detection goes further than that. It is about finding the appropriate way, finding a good access to good quality diagnosis, which enables patients as quickly as possible to see the right specialist and to get the right treatment.